Hi, greetings from IIDL NAPCM. Today we will be covering care of dying, communication and bereavement support. This presentation is prepared by Professor Madhurima Pradhan, Head of the Department of Psychology, University of Lucknow, and she is member of National Association of Palliative Care for Ayush and Integrative Medicine. So, we will be covering the sensitivity to issues related to death, bereavement and loss experienced by clients and their families. Provide alternative coping skills to the affected person to tide over the trauma. Develop and provide a network of support systems to enhance the quality of life. Be sensitive to the needs of empathy and emotional support for better communication. Use the tools for bereavement support. Bereavement, I hope you understand that it is providing support to the family after the death of the patient. Grief is an intense emotional state associated with anticipated loss of someone or something with whom one has had a deep emotional bond. It begins due to awareness of the impending loss of a loved one. It sets in as soon as the symptoms of a life-threatening disease are perceived. Bereavement is the emotional reaction felt following the death of a loved one. A full depression syndrome is considered normal in the case of such a loss and is often accompanied by many physical, emotional and mental symptoms. Mourning is public expression of grief and bereavement, which is determined by cultural and religious beliefs. Culture-specific customs and traditions, religious beliefs and practices affect in grieving mourning process of a family, and friends is a culture-specific too. Symptoms of grief and bereavement. The physical symptoms may be hyperactive or underactive physical distress, chest pain, abdominal pain, nausea, headache, etc. Change in appetite, weight change, fatigue, sleeping problems, restlessness, crying and sighing, shortness of breath, tightness in the throat, etc. Social symptoms may be being overly sensitive, dependent, withdrawn, avoiding others, lack of initiative and lack of interest. In case of emotional symptoms, there may be numbness, sadness, anger, fear, irritability, guilt, loneliness, longing, anxiety, meaninglessness, apathy, vulnerability, abandonment, feeling of unreality and emptiness. In case of behavioral symptoms, forgetfulness, searching for the deceased, slowed thinking, dreams of deceased, sensing the presence of loved one, wandering aimlessly, trying not to talk about the loss, need to retell the story of loved one's death. Types of grief reactions may be anticipatory grief, which may occur when a death is expected. Anticipatory grief may help the family, but not the dying person. Anticipatory grief does not always occur. Normal grief or common grief. Normal or common grief begins soon after a loss and symptoms go away over the time. Many bereaved people will give grief bursts or pangs. Grief is sometimes described as a process that has stages. In complicated grief, there is no right or wrong way to grieve, but studies have shown that there are patterns of grief that are different from the most common. This has been called complicated grief. It includes minimal grief reaction and chronic grief reactions. Now, stages of the grief cycle. In case of normal functioning, There may be shock and denial, avoidance, confusion, fear, numbness, blame. There may be anger, frustration, anxiety, irritation, embarrassment and shame. There may be depression and detachment, overwhelmed, blase, lacks of energy as well as helplessness. Then there may be empowerment, security, self-esteem and meaning, which could be questioned. The dialogue and bargaining, reaching out to others, desire to tell one's story, struggle to find meaning for what has happened would also be there, followed by acceptance, exploring options in a new plan in place, and finally return to the meaningful life. Now, growth through trauma, it is possible through 3 cognitive outcomes of traumatic experience: assimilation, negative accommodation and positive accommodation. How to cope with grieving? Significant loss takes time. Depending on the circumstances of your loss, grieving can take weeks to years. Grieving helps you gradually adjust to a new chapter of your life. So, attend or organize memorial or funeral services, talk to the family or friends, seek counseling, get enough sleep or at least enough rest, try and get some regular exercise, keep a balanced diet, drink plenty of water, drink alcohol in moderation, do what comforts, sustains and recharges, engage in social activities and seek spiritual support too. Now, communication skills may involve active listening. Client is conferred with empathetic listening, showing compassion, adopting humane approach, avoiding clinches, avoiding statement having negative impact, verbal cues for approval language, it is okay, give to cry. So, we have to give approval to the patient. Writing and drawing, letter writing to deceased may help in taking out the emotions. Rituals, traditional ways of mourning, culture specific can help in relieving grief. Role playing and or imagery. This will provide an opportunity to the mourner, an opportunity to say something which he or she could not say. Cognitive restructuring, helping the grieving person to find alternative ways of thinking about the situation to find peace and comfort. The role of counselor or helper can be identifying and legitimizing feelings of sadness, anger, guilt and anxiety, accepting the reality of the loss, helping the person express spoken and unspoken, suppressed and dormant feelings, helping the person overcome difficulties in readjusting to life after the loss, encouraging the person to say goodbye, sometimes before the loss, and complete unfinished businesses, facilitating self-help, help coping skills and reinvesting energy in new ways, providing continuous support and making referrals if needed. To conclude, grief and bereavement support is a process and not an event. The role of the counselor is to facilitate the grieving or bereaved person to express his her thoughts and emotions about the loss and taking creatively the challenges. Client needs to be understood the darkest corners of the experiences, feel safe and comfortable. Effective communication skills can facilitate the process of providing support and care. Thank you.